Welcome back to the second half of NewsBreak Live. Joining me tonight is JHarris, who is one of the prevention coordinators for Behavioral Health Services, Inc. in the South Bay. Jen, this week is very important for your organization as it gives you another opportunity to spread awareness.
Absolutely. I'm really excited. Thank you so much for having me.
Tell me about this National Week.
Well, this week in particular, from January 23rd through January 29th, it's the National Drugs and Alcohol Fact Week. And what's really cool about this week, it gives us an opportunity nationally throughout this particular week, but also every single year to be able to go into communities and go into schools and talk to young people, talk to residents about the different myths that are out there around drugs and alcohol, and to be able to talk with young people in particular about ways to not be influenced by their friends, by social media, by the internet, and making sure that they're getting the right information.
As the prevention coordinator, your job is to spread awareness, so this week must be key to what BHS does.
Absolutely. It's definitely something that we spend a lot of time doing. Myself and I'm the prevention coordinator for our South Bay Prevention. And then we also have two staff, Anna E. Picasso and Michael Radke, who are outreach specialists. And through our work, we have an opportunity to be able to engage residents and especially youth in Torrance year round. And so one of the things that we like to think of is that prevention happens 365 days a year as opposed to just in this 1 week.
And BHS has about 16 locations. So for people who are watching and may not know what the organization does, what is the mission?
Our mission is to transform lives. And one of the ways that we do this is primarily working with our clients around drug prevention and drug treatment services. And so with our program, we have a lot of different classes, like DUI classes. We have classes that focus on parenting, classes that focus on anger management and domestic violence. We recently opened our family health center. We also have an opportunity to provide services for mental health and HIV and AIDS. So we have a large number of programs and services that we do.
And as I just mentioned, there are 16 locations. You have a location here in Torrance, you have a location in Gardena, even in Hawthorne. Tell me about the programs and services that are offered in Torrance.
Yeah, in Torrance specifically, we have a family preservation program. We have programs that focus specifically on outpatient and also intensive outpatient. And so our clients will go through a lot of different classes. They'll meet and go through groups several times a week. They'll also meet individually with their particular case manager or counselor to be able to help them with their treatment program.
There are so many services and programs that BHS offers. I know you touched upon them, but tell me a little bit more about what your office covers and the importance of it.
Absolutely. So with my particular office, as you mentioned earlier, we do have a location in Gardena. And so I am with the South Bay Prevention Program. And so with South Bay Prevention, which is really crazy, but we tend to have a good time explaining it to people. With our South Bay Prevention Program, though we're housed in Gardena, we focus primarily on the cities of Torrance and LOMITA. We also have two additional prevention teams, and one team is housed at the Torrance office, but they focus on Hermosa Beach, Redondo Beach, and Manhattan Beach. And then our last location, prevention location, is in Hollywood, and they work with residents in Hollywood. So with my particular program, we like to engage residents in Torrance around drug prevention. We have a lot of different drug-free events that we do, one being Red Ribbon Week. We also put on an annual Drug Prevention Youth Summit. We also have a Parent Summit, and we have a really good time because we get to work with Torrance PD to put on prescription drug take-backs every year. And so with those types of events, we have an opportunity to raise awareness about alcohol and drugs and how they affect our young people. We also have an opportunity to work with elected officials, and so we work with City Council on passing policies. Right now we're working with the City of Torrance and also with Torrance PD around passing a social host ordinance that focuses specifically on holding adults responsible for providing alcoholic beverages to minors.
And you were just talking about TPD, the City Council. It's a community collaboration. Mention some key partners that are involved with your organization that makes everything possible.
Absolutely. And I need to be very clear, without those community partnerships, we would not be able to do almost anything that we do. So it's really key for us to work with the city of Torrance. We also, as I mentioned, work with Torrance PD. We work with the city of Gardena. We also work with Gardena PD. We have an opportunity to work with a lot of local service organizations, 186th Street Elementary School, Torrance Unified. We receive our funding from LA County SAPC, which stands for Substance Abuse Prevention and Control. We work with several coalitions. One is Rethinking Access to Marijuana, South Bay Communities Creating Change, and the Gardena Drug and Alcohol Abuse Prevention Task Force. So with these partnerships, they help to move the work that we do forward. They also, a lot of them are Torrance residents, and so it helps to be able to get their input on what we should be doing to be able to help support the community.
And the topics of drugs and alcohol, sometimes it's not something a lot of people want to talk about. No. So how do you get that awareness out there? And for viewers that are watching that may have a concern or have any questions, how can you encourage them to maybe take advantage of this great resource that's right here in the South Bay?
Absolutely. I think the biggest piece that a lot of people don't know is that our resource is free. And a lot of times when they think about drug prevention, a lot of times I hear parents say, well, it's not my child. My child's not doing it. It's that other person over there. Or, oh no, I know my neighbor gives their children alcohol, but they would never give my child alcohol. And so one of the things I try and do is make sure parents are encouraged, making sure that they're encouraged to know that there is support that's out there for them as parents, and that there are healthy ways to be able to communicate with their children. Myself, Anna E., and Michael, we have an opportunity to be able to engage them with a lot of the outreach that we do. We have an opportunity to talk with them about some of the drug trends that are out there that they may not know, or being able to engage youth in our Torrance Unified Schools and talk with them about how drugs really do kill their dreams, which is one of our programs, is our Drugs Kill Dreams program. And through our program, we talk with young people about real ways to say no to drugs and alcohol.
Speaking of that program, in light of National Drug and Alcohol Facts Week, there's actually an event happening tonight. You're very busy at CASIMIR Middle School. So tell me about the event, the focus of it. Anyone can come out tonight.
Yes, so our event tonight is titled Beyond, I'm sorry, our event tonight.
Beyond the Basics,
yes,
I'll help you
out. It's titled
out.
Beyond the Basics. I'm sorry, you can tell, so much going on. Beyond the Basics, Youth and Marijuana. And so with this particular event, we're focused specifically on marijuana. Even though there are so many drugs out there right now that are trending, this event is looking at what are some of the trends that are happening with marijuana. So we're going to focus on edibles. We're going to focus on dabs and waxes. A lot of people don't know that you can vape marijuana. So we're going to cover those things, but we'll also look at healthy ways parents can communicate with their children. So it will be tonight at CASIMIR Middle School, and it will be at 6 p.m.
It's for parents, it's for students.
Yes.
Well, I know you just mentioned you'll be talking about trends. Will it be a presentation format? Just if anyone's interested, what can they expect?
Absolutely. So we have a youth speaker that will be coming and talking about their interaction with marijuana use and some of the things that happened to them that led to their drug use. We'll also have an interactive workshop. So we have a really cool activity called Spot the Pot. And so with this activity, a lot of times when we look at the brownie or we look at the orange slice or some of those trending edible items, we're looking at them and saying, oh, that's just a regular item. But a lot of times those things have marijuana in them. And so this is a tool to be able to educate parents and also young people on the types of things that are out there and how they can protect themselves.
How many people in Torrance do you serve?
So with our treatment program, within the fiscal year of July 2015 to June 2016, we served approximately 4,800. It was, I believe, a little bit over 4,700. And so with that particular number, in our South Bay, those are our South Bay numbers. With Torrance specifically, we serve 713 residents. And so we have a lot of those, a lot of our classes that the clients are going to. And with our prevention program, we put on a lot of different activities and events. We have workshops, we have our youth summits and these larger things. And so we served about 4,600 within that fiscal year.
Wow, it's a lot of people. And it's beyond just prevention. The health center, which we spoke about earlier, it's more new to the area.
Yes.
And it offers so much for people who may not be able to afford some sorts of health care.
Yeah, we have a really great opportunity with our Family Health Center. We call it our community clinic as well. So it may go by either name, but it is located in Hawthorne, and we serve any and everyone. So a lot of people, even though the Affordable Care Act came out, a lot of people have gotten health care coverage, whether it's been Covered California, they have their own private insurance, or Medi-Cal. However, there's still a lot of people that are uninsured. So we do have enrollment specialists that are available to help folks in the community sign up for Covered California and also Medi-Cal. We also we have physicians that provide primary care, we provide prenatal care, we have pediatrics, and we do provide mental health service and a gamut of things. And so we encourage residents to come out. Even though the location is based in Hawthorne, we're really looking to serve the South Bay community, and Torrance is included in that.
I know tonight we just touched upon all the great things BHS does, and if someone would like to speak with you or learn more, tell me how they can contact you, the best number, and there's also a website.
Absolutely. So my name is JHarris, and I am the prevention coordinator with South Bay, and you can contact me at 310-321-8466, or you can contact me via email at jharris@bhs-inc.org, or you can go to our website at www.bhs-inc.org.
And before we go, there are 2 more events already scheduled here in Torrance for this week.
Yes, so we do have our Drugs Kill Dreams program going on. Yesterday we started our first day at CASIMIR, and it is CASIMIR Middle School, and it is a 10-week program, and the students have an opportunity during this program to plan an event for the students on their campus. So last year we were at Jefferson, Hull, and CASIMIR, and we are back again, and we're really excited about it. We'll also be at Jefferson on Thursday and also at Hull on Friday. So students have an opportunity to participate in the groups, learn some really great information, and plan some drug-free events.
Jen, it was a pleasure having you on my show. Thank you so much for your time.
Absolutely.
I know you're going to rush over to the middle school now.
Yes, and please, everyone, come on and join us, and we will have some refreshments as well.
Thank you again. Have a great night.
Thanks, you as well.
That was JHarris with Behavioral Health Services, Inc. She can be reached at 310-321-8466, or you can email her at jharris@bhs-inc.org. Check out their website at bhs-inc.org where you can get all the resources and information. And for some general information, you can also call 310-679-9126. Well, that does it for NewsBreak Live. City Council is back on the dais tonight. If you have ever news or video that you'd like to share, please email us on newsbreak@torranceca.gov. And for Facebook and Twitter users, please use #NewsBreakLive. We'll see you next time. Have a great night.